Welcome to the presentation, Mapping Views of Physiotherapists on Factors in Ethical Decision-Making. My name is Andrea Sturm. I'm a physiotherapist and PhD student from Austria. The increasing complexity of ethical challenges in everyday practice has been recognized in several studies. Emerging research from all world regions suggests different cultures and societal structures influence the ethical experiences of physical therapists. Still, there is a lack of knowledge about the factors that play a role in physiotherapists' ethical decision-making, in addressing, responding, and resolving these complex ethical challenges. This is John Doe, a dedicated and well-trained physiotherapist. He aims to both serving their patients and representing the profession in the best possible manner by complying with the Code of Ethics. But his field dependence and external pressures contradict his professional attitude and sound moral intentions. Obviously, being a moral agent is not that simple. In this study, we aimed to explore physiotherapists' perceptual weighting of diverse factors influencing ethical decision-making internationally, to map these various factors, and to describe the scope of individual and situational, organizational, and societal factors. We developed a survey with 44 items in English. Based on research of ethical decision-making in healthcare management and management ethics, we created 30 statements. 16 items were addressing individual factors and 14 items addressed situational, organizational, and societal factors. Because their characteristics in the literature were overlapping, we amalgamated these three factor categories in the survey. The level of agreement to the statements could be indicated on a 5-point Likert scale. An optional opportunity to individually describe additional factors that play a role in their ethical decision-making was provided at the end of the survey. The survey link was online for 12 months and was promoted by a license-free advertisement. The study was also introduced by a blog post on Physiospot and a pop-up at the Physiopedia wiki sites for 8 weeks. We wrote emails to all World Physiotherapy associations with a request to share the survey link with their members. Printed invitations were handed out at the World Physiotherapy Conference in Geneva 2019. Descriptive, statistics, and qualitative methods were used for data analysis. We coded the individual responses in 3 steps. First, we identified responses that were unintelligible or those stating nothing more to add. Then we coded the remaining responses into 3 categories: responses thematically directly associated and thematically indirectly associated with the survey items in section 2. And further, we identified responses pointing out to new themes or other aspects of factor categories underpinning the survey statements. In a second step, we coded these new themes into categories or subcategories of given themes. Thirdly, we created a list embracing all these factors, those originally underpinning the survey statements and those we newly identified. We allocated all 200 individual responses to these categories and subcategories, and I will show you specific examples in the results section of the presentation. In this infographic, you can see the graded numbers of participants for each country represented by different colors. 415 completed the entire survey of the overall 554 participants from 72 countries. Half of them responded to the optional open question at the end of the survey. Half of the overall sample were located in the European region of World Physiotherapy. This is also reflected in the high numbers of participants who indicated Christianity or secularity, atheism, as their religious or non-religious preferences. Here is a ranking of the statements that the participants either strongly or agreed to. Some underpinning factors were, for example, professional role and attitude, organizational culture, significant others, code of ethics, awareness, or system of reward or punishment. Almost half of the sample learned about ethical decision-making frameworks in their entry-level education. A quarter of the participants did not. More participants learned about ethical decision-making on their own or from others than in professional ethics courses. Ethics courses were described as providing information about areas they would otherwise not have been exposed to. Other sources of learning were professional bodies, lawyers, or ethics committees. And here you can see the various factors we identified in the qualitative analysis. The most often occurring factors were related to the patient, followed by the physiotherapist-patient relationship, experience, moral intent, and significant others, such as colleagues, mentors, or other health professionals. There is an impression of the complexity of the subcategories we identified, for example, in the patient's factors category. Patients' preferences and financial status were mentioned the most often, as well as their family system, individual states, and their wants and needs. Coming to an end of this presentation, what does this mean? As complex as ethical situations encountered by physiotherapists are, as complex is their ethical decision-making. It is based on a web of relational and contextual factors interrelated with all protagonists and situated in socio-cultural systems. Patient factors and characteristics of the relationship between physiotherapists and patients and/or their families are considered as playing an important role in physiotherapists' ethical decision-making. The informal ways of learning about ethical decision-making and ethical reasoning, especially from colleagues and on their own, should be supported by easily accessible knowledge provision, considering individual, professional, and personal experiences and values. More research exploring these factors in various contexts in depth is needed and recommended. Thank you for your interest.